So a facelift essentially is a fairly safe operation. People think it's a big operation or a difficult operation. I don't think it is, but personally. I have to say that I have never, ever in my life had an unhappy patient after a facelift, so that's a good thing. So when it comes to complications, you have the early and light ones, so you can have most commonly definitely you will have bruising and swelling. Sometimes you have a bit of blood under your skin, and that's called what you call a hematoma. So the side of your face can go bigger with a bit of collection of blood under the skin, and that can be drained either with a little needle or you need a small operation to fix it. This just delays the healing by a week or two and causes a lot of bruising. So sometimes you can have an infection. I think the most common problem after a facelift, which is not really a big one, is that sometimes the scars, especially at the back of the ear, can be a little bit lumpy. So not a fine hairline. You want the scars to be like a fine hairline, practically invisible, and most of the times they are like that. But sometimes they can get a little bit thick, like a millimeter thick at the back of the ear, and that can be. And I've seen it maybe 2 or 3 times. And you can treat that with some specific dressings and some steroids. The bigger complications and the more severe complications are the ones that you don't really want to see. So there is this nerve in the face called the facial nerve. For people that have heard the term Bell's palsy, it's that nerve. So basically it's the nerve that gives movement to the face. It's got 5 branches. Remember your palm of your hand. It kind of goes like that. And it's basically underneath this mass layer of the face where we kind of tighten. So sometimes this can be caught, and when I say sometimes, I've never done it. It never happened, so that's good. I don't want to see it ever. But it can actually be caught and gives you usually a temporary weakness of the face, and not the whole face, but only 1/5, one segment of the face. So it's usually there or there or there or there or there. And this tends to settle within 2 or 3 months. The books again say, because that's not my experience, the book again say that there is 1 in 2,000 chance of having a permanent weakness of the face of this segment, and that is if the nerve is actually cut. And I don't know how I could do it, because the way I do this operation, that's not really likely at all. Nothing is impossible, but it's just not very likely. And the last complication that you can get with a facelift is what you call sloughing, or a bit of delayed wound healing, where the skin just usually next to the ear can become a little bit scabby and be replaced by scar tissue. I've seen it a couple of times, both times in smokers. Smoking is a big no-no when it comes to facelift surgery or any surgery. But we didn't really have to do anything about it because it settled so well, so it was just perfect.